People already suffer, and they take the risk not to buy insurance knowing that it'll be expensive if they have some sort of catastrophic health event that requires them to spend. 30% additional is not enough of an incentive, so there's got to be something stronger to get people to buy insurance when they're healthy, and that's not in this plan. Hopefully it would be in something that would come out of the U.S. Senate as a moderating influence on this House bill. There could be some vital insurance reforms that were necessary before the ACA and now are necessary during the continuity of the Affordable Care Act that would reduce the administrative costs and put greater controls on the insurance industry, putting, as Republicans would like, patients and their providers back in charge of care and reducing costs by adequate cost sharing and rationing that's conducted by the individual healthcare consumer and not by these insurance that are effectively serving as, in many cases, Sarah Palin-like death panels. So there are fundamental reforms that should be made to the ACA and that can be market-based, that should be in a compromised version that would be influenced by the U.S. Senate Republicans. You're hearing from these U.S. senators who are very strong on economics and understand what is necessary to create a sustainable healthcare system. And by the way, they're conservatives like Rand Paul and Mike Lee, but also representative of states like Ohio and Alaska with Rob Portman and Lisa Murkowski, those states that potentially stand to be the hardest hit, the red states, by the current proposal from the U.S. House. And so I think that the U.S. Senate could be a very moderate influence that creates a system that is sustainable if they can get their hands on this bill.